The United States faces a troubling health crisis affecting Black mothers. A Black woman in America is 3 to 4 times more likely to die from pregnancy-related causes than a white woman. This is the reality today, in 2025. The joy of bringing new life into the world should not carry such a disproportionate risk based on race. This disparity signals deep-seated problems within our society and healthcare systems. The loss of a mother has devastating consequences, affecting families and communities. Each statistic represents a human life lost, a family shattered. The reasons behind this crisis are complex, involving social determinants of health and systemic racism. Access to quality care and the prevalence of chronic health conditions play significant roles. We must implement concrete strategies that create real change. The health and well-being of Black women during pregnancy and childbirth must become a national priority. This is a fight for justice, equality, and the fundamental right to safe motherhood. The CDC provides critical data on the maternal mortality crisis. The maternal mortality rate for Black women is significantly higher than for other racial groups. In recent years, the rate for Black women has been approximately 40 to 50 deaths per 100,000 live births. This stands in stark contrast to the rate for white women, closer to 15 to 20 deaths per 100,000 live births. This disparity persists regardless of socioeconomic status or education level. A Black woman with a college degree is still more likely to die from pregnancy-related complications than a white woman with less than a high school education. This suggests that systemic issues, including racial bias in healthcare, play a powerful role. Many of these deaths are preventable with timely and appropriate care. This underscores the urgent need to improve the quality of maternal health care for Black women. The CDC's surveillance of maternal deaths helps identify leading causes, such as cardiovascular conditions, infection, and hemorrhage. Understanding these specific medical reasons is important. However, it is equally important to understand the context in which these conditions become fatal for Black women at higher rates. Addressing these disparities requires a commitment to health equity at every level of the healthcare system. We have the power to change this narrative. Black women often face a higher burden of chronic health conditions. Conditions like hypertension and type 2 diabetes are more prevalent in the Black community. Managing these conditions before and during pregnancy is crucial. However, access to consistent, quality care can be a challenge for many Black women. Obesity is also more common among Black women in the U.S. Obesity during pregnancy is linked to complications like gestational diabetes and preeclampsia. Cesarean deliveries, while sometimes necessary, carry their own set of risks. Addressing these underlying health conditions requires a holistic approach. This includes considering social and economic factors influencing health. Systemic racism also plays a role by creating stressful living conditions and limiting opportunities for health. Addressing these chronic health conditions in Black women requires more than just medical interventions. It requires addressing the social determinants of health that contribute to their development. This comprehensive approach is essential for reducing pregnancy-related risks. Cardiovascular conditions are a leading cause of pregnancy-related deaths in the U.S. For Black women, the impact of these conditions is particularly severe. Diseases like cardiomyopathy and hypertension contribute significantly to higher maternal mortality rates. Black women are diagnosed with postpartum cardiomyopathy at higher rates and often experience worse outcomes. Chronic hypertension, if not well managed, places enormous strain on the cardiovascular system. Preeclampsia is also a significant threat, with a higher incidence and severity in Black women. The physiological stress of labor and delivery can unmask or worsen underlying heart conditions. The postpartum period is often when women have less contact with the healthcare system, creating a window of vulnerability. Addressing the impact of cardiovascular disease requires better screening and management of risk factors. Healthcare providers must be trained to recognize and respond to these signs quickly, without bias. Research is needed to understand why Black women are more vulnerable to these conditions. Developing targeted interventions is crucial. Cesarean sections, or C-sections, are a common surgical procedure used for childbirth. While life-saving in certain situations, they carry risks like infection, blood loss, and blood clots. Black women in the U.S. have higher rates of C-sections compared to white women. This disparity contributes to maternal health inequities and can lead to more complications. The reasons for higher C-section rates among Black women are complex. They may include higher rates of medical indications like preeclampsia or fibroids. However, provider practices and hospital policies also play a role. Implicit bias may influence decisions about mode of delivery. Overuse of C-sections can lead to unnecessary surgical risks. Reducing unnecessary C-sections is an important strategy for improving maternal safety. This involves promoting evidence-based labor management practices and supporting shared decision-making. Hospitals can review their C-section rates and implement quality improvement initiatives. Providing access to doula care and midwifery services has also been shown to reduce C-section rates. Systemic failures within the healthcare system play a crucial role in higher maternal mortality rates among Black women. One significant gap is the delayed recognition of symptoms. Black women often report that their pain or concerns are dismissed by healthcare providers. This can lead to dangerous delays in diagnosis and treatment. Poor postpartum follow-up care is another critical system flaw. Many Black women do not receive adequate postpartum care. They may face barriers to accessing follow-up appointments. Hospital infrastructure gaps can also contribute to adverse maternal outcomes. Black women are more likely to give birth in hospitals with poorer safety records or fewer resources. A lack of culturally competent care can create barriers to effective communication and trust. Building a diverse healthcare workforce trained in cultural humility is essential. Addressing these systemic failures requires a comprehensive overhaul of maternal healthcare delivery. To address the maternal mortality crisis among Black women, we must implement comprehensive and targeted solutions. Early identification of risks is paramount. This means thorough screening for chronic health conditions and cardiovascular risk factors. Maternal early warning systems, or MEWS, are vital tools. MEWS help healthcare teams quickly recognize and respond to early signs of clinical deterioration. Robust postpartum monitoring and support are essential. Care should extend well beyond the traditional 6-week checkup. This includes access to home visits, telehealth services, and mental health support. Optimizing decisions around cesarean deliveries is crucial. Promoting vaginal birth whenever safe and appropriate can reduce non-medically indicated C-sections. Improving preconception health through community-based programs can help women enter pregnancy in better health. Upgrading hospital safety protocols can improve outcomes for all mothers. The CDC has implemented strategies to reduce Black maternal mortality, including the Black Maternal Health Week, recognized each year from April 11th, 17. The CDC supports states through the Enhancing Reviews and Surveillance to Eliminate Maternal Mortality, ERASE-M program. This program helps understand the drivers of maternal mortality and complications of pregnancy to better prevent maternal deaths and reduce racial disparities. The CDC also supports state perinatal quality collaboratives, PQCs, to improve the quality of care for mothers and their babies. Additionally, the CDC promotes the Hear Her campaign to raise awareness of potentially life-threatening warning signs during and after pregnancy. These multifaceted solutions, implemented with a focus on equity, can save lives. The maternal mortality crisis affecting Black women in the U.S. is a profound injustice. Black women are 3 to 4 times more likely to die from pregnancy-related causes than their white counterparts. This disparity is not explained by socioeconomic status or education level alone. It points to deeper systemic issues that demand urgent attention. Black women experience a higher burden of chronic health conditions. Cardiovascular diseases are a leading cause of maternal death. Higher rates of cesarean sections introduce additional surgical risks. Systemic failures within the healthcare system are major drivers of this crisis. Delayed recognition of symptoms and inadequate postpartum follow-up care are critical issues. Gaps in hospital infrastructure and a lack of culturally competent providers exacerbate these inequities. Understanding these interconnected causes is crucial. This is not simply a medical issue, but a social justice issue. The unacceptable rate of maternal mortality among Black women is a call to action. We must move beyond acknowledging the statistics and work to dismantle the structures that perpetuate these disparities. This requires holding healthcare systems accountable for providing equitable care. Improving support for Black mothers must be a multifaceted endeavor. This includes ensuring universal access to affordable, high-quality prenatal, intrapartum, and postpartum care. Expanding Medicaid coverage for a full-year postpartum in every state is crucial. Increasing funding for community-based programs that provide culturally congruent support is essential. Healthcare providers must receive comprehensive training on implicit bias and cultural humility. We need a more diverse healthcare workforce that reflects the communities it serves. Listening to and centering the voices of Black women is vital. Achieving maternal health equity for Black women is a matter of justice. We must advocate for policies that address the social determinants of health. Bold, transformative action is needed to ensure every Black woman has a safe and healthy pregnancy and childbirth. Watch my video on preeclampsia and how it affects maternal health.